you like to see?
What do you have here? My position here at CSU is unique. I'm an infectious disease trained physician, and I provide really that link between the basic scientists and the important work that they do and the patients. It's providing clinical insights, what's important to look at. I don't necessarily know how to do it, or the analytical tools, or the skill set to do the bench work, the basic science research, but I know the important questions to ask. And that helps them put their findings and their research into the context of human patients with tuberculosis. Some little small granulomas around the airways. Tuberculosis is a disease that predominantly affects those in developing countries and certain emerging economies. China and India are high-burden countries as well. It is a global problem, and we still have tuberculosis in this country, but the cases are really much fewer in the United States. So it's predominantly interfacing with U.S. or international investigators who are doing clinical trials around the world, predominantly in areas of high burden of tuberculosis, and much of that is in the developing world.
So how many months more do you have?
2 more.
2 more months.
As a young infectious disease fellow, I really had a fortunate opportunity to do a Fulbright scholarship in the country of Zambia in Africa. And that really opened my eyes to this dual epidemic of HIV and tuberculosis. In lesions surrounding the airways, which is this clear space here, you can actually see a nice demonstration of the airways branching like a tree branch off into the periphery of the lung. Coming to CSU has been really a gift for me because I can interface with real scientists who have technologies such as what's happening in Dr. Belisle's lab for potential for tests that could be modified or fitted to an inexpensive platform in the future that could be made available in places, in the clinics, in the local setting, in resource-poor areas to make a rapid diagnostic test for tuberculosis. The number of lesions have increased, and the amount of surface area of the lung involved with tuberculosis is greater. So I think it's an exciting time to be working at CSU and with colleagues around the globe, because we have now, for the first time in many, many decades, new and novel agents with novel mechanisms of action to try to get at the tuberculosis organism in a different way. And our hope is that studying these regimens for treatment of tuberculosis will shorten that period of time required to cure disease. While progress has been made in tuberculosis around the globe, it's not a time to rest. In fact, it's a time in which we should redouble our efforts at new therapeutic discoveries, new diagnostic discoveries, new vaccines, such that we can have a hope of trying to eliminate TB in our lifetimes. I think some of the best scientists and basic scientists in tuberculosis are right here at Colorado State University, and I'm proud to be a member of a team where we can potentially have a great impact on human suffering, and after all, that's what this is all about.